Prediabetes red flags. 10 symptoms you must watch out for. Could you be on the brink of diabetes without even realizing it? Subtle changes in your body might be warning you about your blood sugar levels. But are you paying attention? In this video, we'll uncover the 10 red flags of prediabetes and show you exactly how to take charge before it's too late. Prediabetes is often called the silent warning for diabetes, and that's because it can sneak up on you without obvious signs. Many people overlook or dismiss the early symptoms, but catching them in time can be a game changer for your health. Identifying prediabetes is crucial because with the right steps, it's possible to reverse it and avoid long-term complications like type 2 diabetes or heart disease. In this video, we're diving into 10 key symptoms of prediabetes and giving you actionable tips to take control and protect your health. Stay tuned. Some of these might surprise you. Number 1. Constant fatigue. Feeling constantly tired could be more than just a sign of a busy lifestyle. It might indicate prediabetes. Insulin resistance, a hallmark of prediabetes, disrupts the body's ability to effectively absorb glucose into the cells. Glucose is your body's primary energy source, and when it's not being utilized properly, your energy levels take a major hit. This means your cells are essentially starving for energy, even though there's plenty of sugar circulating in your bloodstream. What makes this symptom particularly tricky is that it can be easily dismissed as just being overworked, stressed, or sleep-deprived. You might find yourself waking up after a full 8 hours of sleep and still feeling drained, struggling to get through your day without multiple cups of coffee or sugary snacks. This persistent exhaustion isn't something to ignore, especially if it's paired with other subtle changes in your health. If you're dealing with this kind of fatigue, it's time to pay close attention to your diet. Focus on eating balanced meals with plenty of fiber, lean protein, and healthy fats to stabilize your blood sugar. Avoid quick fixes like sugary drinks or processed snacks, which might give you a temporary boost but ultimately make things worse. The most critical step, however, is to consult your doctor. Request a blood sugar test to check for prediabetes or other underlying issues that could be causing your fatigue. Catching this early gives you a chance to reverse the condition through lifestyle changes like diet, exercise, and stress management. Don't let constant fatigue become your new normal. Your body might be trying to tell you it needs help. Number 2. Increased thirst. Feeling thirsty all the time, even when you're drinking plenty of water, might be a sign that something isn't right with your blood sugar levels. When blood sugar levels rise, your body tries to get rid of the excess sugar by flushing it out through urine. This process causes your kidneys to work overtime, pulling more water from your system to dilute the sugar and eliminate it. The result? Dehydration and a persistent feeling of thirst, no matter how much water you drink. This symptom can be subtle at first. You might notice yourself refilling your water bottle more frequently or waking up at night with a dry mouth. Over time, though, the thirst becomes harder to ignore. It's important to understand that increased thirst isn't just inconvenient. It's your body's way of signaling that glucose regulation is out of balance, which could indicate prediabetes or even diabetes. If you're experiencing this, start by tracking your water intake and any other symptoms, such as frequent urination or dry skin. Sometimes people mistake their thirst for dehydration due to hot weather or physical activity, but when it's tied to elevated blood sugar, no amount of water seems to quench it. The next step is to consult a healthcare provider. They can perform a simple blood test to check your glucose levels and assess whether prediabetes is a factor. Catching this symptom early can make a huge difference. By adjusting your diet to include fewer refined carbs and sugars, staying active, and managing your weight, you can improve your body's ability to regulate blood sugar and reduce these unpleasant symptoms. Remember, thirst might seem harmless, but it could be one of the earliest signs that your body is struggling with insulin resistance. Number 3. Frequent urination. Are you finding yourself running to the bathroom more often than usual, especially during the night? Frequent urination, known as polyuria, can be an early warning sign of prediabetes. This symptom occurs because elevated blood sugar levels overwhelm your kidneys, forcing them to work overtime to filter and remove excess glucose from your bloodstream. As a result, your body produces more urine to flush out the sugar, leaving you visiting the bathroom far more often than normal. This symptom is especially noticeable at night. If you're waking up multiple times to urinate, even though you haven't had much to drink before bed, it could be a red flag. During the day, you might notice an increased urgency to go or feel like your bladder is never quite empty. For many, this can be disruptive and frustrating, impacting sleep quality and daily activities. Frequent urination is more than just an inconvenience. It's a sign that your body's glucose regulation is off balance. It also contributes to dehydration, as you're losing more water than usual, which can, in turn, worsen other symptoms like thirst and fatigue. To address this, start by keeping a log of how often you're urinating, especially at night. Note any patterns, such as whether it gets worse after consuming certain foods or drinks high in sugar or carbs. Then, consult your doctor for further evaluation. A simple blood test can determine if your blood sugar levels are higher than they should be and whether prediabetes is a concern. Making lifestyle changes, such as cutting back on sugary foods, increasing physical activity, and staying hydrated with water instead of sugary beverages, can help improve your blood sugar levels and ease the symptom. Remember, frequent urination isn't just a nuisance, it's your body's way of signaling that it needs attention. Catching and addressing this symptom early can make a big difference in preventing the progression to type 2 diabetes. Number 4. Blurred vision. Have you been struggling to focus or noticed that your vision seems a bit blurry lately? Blurred vision is one of the subtle yet important warning signs of prediabetes. This symptom happens because fluctuations in blood sugar levels can affect the lenses of your eyes. When blood sugar rises, it draws fluid into the eye's lens, causing it to swell and temporarily alter its shape. As a result, your ability to focus can become impaired, leading to blurry or distorted vision. Unlike more permanent eye problems, this type of blurred vision often comes and goes, depending on your blood sugar levels. You might notice it getting worse after meals or during times of stress. While it's easy to brush off blurry vision as strain or fatigue, especially if it's not constant, it's a sign you shouldn't ignore. Early blood sugar changes can lead to long-term damage to your eyes if left unchecked, such as diabetic retinopathy, a condition where blood vessels in the retina are damaged. If you're experiencing blurry vision, the first step is to schedule an eye exam with your optometrist or ophthalmologist. Let them know about your symptoms and mention if you have a family history of diabetes or prediabetes. An eye exam can reveal whether blood sugar fluctuations are affecting your eyes or if there's another issue at play. In addition, it's essential to monitor your blood sugar levels. If you haven't already, talk to your doctor about getting tested for prediabetes. Early detection can prevent the progression to diabetes and help you avoid complications, including more severe eye issues. To help manage your blood sugar and prevent further vision problems, adopt healthy habits such as eating a balanced diet, exercising regularly, and avoiding high-sugar foods that can cause blood sugar spikes. Blurred vision might seem like a minor inconvenience, but it's your body's way of warning you about underlying changes that need attention. Catching it early gives you the chance to protect your eyes and your overall health. Number 5. Unexplained weight gain or loss. Have you noticed sudden changes in your weight without altering your diet or exercise routine? Unexplained weight gain or loss can be a significant red flag for prediabetes. This symptom stems from insulin resistance, a condition where your cells stop responding effectively to insulin. As a result, your body struggles to metabolize glucose for energy, causing disruptions in your metabolism that can lead to noticeable weight fluctuations. In some cases, prediabetes can lead to weight gain, particularly around the midsection. Elevated insulin levels signal your body to store more fat, especially in the abdominal area. Even if you're eating the same amount and staying active, this metabolic imbalance can cause your body to hold on to excess fat, making it harder to manage your weight. On the other hand, some people experience unexpected weight loss. When your cells can't effectively use glucose for energy due to insulin resistance, your body starts breaking down fat and muscle to compensate. This process can lead to rapid, unintentional weight loss that may seem alarming. Pay attention if you've gained or lost a significant amount of weight, 5 to 10 pounds or more, over a short period without any lifestyle changes. Coupled with other symptoms like fatigue or increased thirst, this could indicate prediabetes or even the early stages of diabetes. If you're experiencing unexplained weight changes, it's essential to consult a healthcare provider. They can run blood tests, such as an A1C test or a fasting glucose test, to determine if prediabetes is the underlying cause. Weight fluctuations can also signal other health issues, so it's crucial to get a comprehensive evaluation. In the meantime, focus on maintaining a balanced diet rich in whole grains, lean proteins, healthy fats, and plenty of non-starchy vegetables. Pair this with regular physical activity to improve insulin sensitivity and support a healthy metabolism. Managing stress and getting enough sleep are also key, as both factors can influence your weight and blood sugar levels. Unexplained weight changes might seem confusing or even frustrating, but they're often your body's way of signaling that something isn't right. By taking action early, you can address insulin resistance, reverse prediabetes, and regain control of your health. Number 6. Darkened skin patches. Have you noticed dark, velvety patches of skin appearing on your neck, armpits, or groin area? These skin changes, known as acanthosis nigricans, are one of the earliest physical signs of insulin resistance, a key driver of prediabetes. When your body starts to become resistant to insulin, it compensates by producing more of it. Elevated insulin levels can cause skin cells to grow abnormally, leading to thickened, darkened areas of skin. These patches may feel soft and velvety to the touch, and while they're not harmful themselves, they are a warning sign that your body is struggling to manage blood sugar effectively. Darkened patches of skin often appear in areas where the skin folds or creases, such as the back of the neck, under the arms, or around the groin or inner thighs. Sometimes these patches might also be accompanied by slight itching or discomfort, though they're typically painless. If you notice darkened skin patches, don't ignore them. They're a clear signal that your body may be developing insulin resistance. Schedule an appointment with your doctor for a full evaluation. Your healthcare provider will likely recommend blood tests, such as fasting glucose or an A1C test, to assess your blood sugar levels and determine if prediabetes is the cause. In the meantime, adopting lifestyle changes can help improve insulin sensitivity and potentially reduce the appearance of these patches over time. Focus on eating whole, unprocessed foods, reducing sugar and refined carbohydrates, and engaging in regular physical activity like walking, swimming, or strength training. Even a modest weight loss of 5 to 7% can significantly improve insulin resistance. While darkened skin patches might seem like a cosmetic issue, they're actually your body's way of signaling that it's time to pay attention to your metabolic health. By acting early, you can take steps to reverse insulin resistance and lower your risk of developing type 2 diabetes. Number 7. Slow wound healing. Have you noticed that cuts, scrapes, or even minor injuries seem to take longer to heal than they used to? This could be an early sign of prediabetes. High blood sugar levels can damage your blood vessels, impairing circulation and reducing the flow of oxygen and nutrients to injured areas. As a result, the healing process is slowed down, making it harder for your body to repair itself. When blood sugar levels are consistently high, it can lead to poor circulation, which is why wounds, even small ones, may appear to linger longer. This can be especially concerning for people with diabetes or prediabetes, as slow wound healing increases the risk of infections and complications. You might notice that not only do cuts take longer to close, but they may also become red, swollen, or infected more easily. If you're dealing with a wound that won't heal despite proper care, it's important to seek medical advice to rule out any underlying conditions, such as diabetes or circulation problems. If you notice slow wound healing, it's crucial to monitor your blood sugar levels and keep the affected area clean to prevent infection. Make sure you apply proper wound care, such as antiseptics, bandages, and keeping the wound covered. If the injury doesn't improve after a few days or shows signs of infection, like increased redness or pus, contact your healthcare provider. In addition to addressing the immediate wound care, this symptom highlights the importance of managing blood sugar levels effectively. Regular monitoring of your blood sugar, maintaining a balanced diet, staying active, and managing stress are all key ways to keep blood sugar in check and promote quicker healing. Don't let slow wound healing be ignored. It's a clear signal that your body might need a little extra care when it comes to managing blood sugar. Number 8. Tingling or numbness. Have you experienced that strange sensation of tingling, prickling, or even numbness in your hands or feet? This could be an early warning sign of prediabetes or diabetes. High blood sugar levels over time can damage the nerves, particularly in the extremities. This condition is known as diabetic neuropathy, and it can start with mild sensations like tingling, but if left unaddressed, it can lead to more serious problems, such as loss of sensation and muscle weakness. When blood sugar levels are too high for extended periods, they can damage the nerves that send signals to the rest of your body. The result can be these persistent sensations in your hands, feet, or sometimes even the arms and legs. The feeling may come and go, or in some cases, it may be constant, especially at night when your body is at rest. If you notice a recurring pattern of tingling or numbness, it's essential to pay attention and take action. If left untreated, diabetic neuropathy can become progressively worse, leading to difficulties in walking or using your hands. In severe cases, it can cause infections or injuries that go unnoticed due to the loss of feeling, increasing the risk of complications. Early intervention can help prevent further nerve damage and allow you to manage the condition before it becomes more debilitating. The best way to address this symptom is to take control of your blood sugar levels. Regular monitoring, maintaining a healthy diet, staying active, and managing stress are all crucial steps to help manage your glucose levels and prevent nerve damage. If tingling or numbness persists, be sure to consult with your healthcare provider. They can help evaluate your blood sugar levels and recommend treatments to prevent or slow down nerve damage. Don't ignore these early signs. Catching them early can help protect your overall health and well-being. Number 9. Increased hunger. One of the lesser-known symptoms of prediabetes is an increased feeling of hunger, which might seem odd, especially if you're eating regularly. However, when your body becomes resistant to insulin, your cells are unable to absorb glucose properly, leaving your body craving more energy. This can make you feel hungrier more often, even shortly after eating. In addition to feeling hunger soon after meals, you might also experience cravings for carbohydrates and sugary foods, which provide a quick source of energy, but ultimately, they contribute to fluctuating blood sugar levels. This constant hunger is your body's way of trying to compensate for the lack of glucose entering your cells, which can lead to overeating and poor dietary choices. The body wants to maintain normal glucose levels, so it signals hunger to encourage you to consume more food, but unfortunately, this hunger doesn't always help the body regulate its sugar levels properly. To help manage this symptom, it's important to focus on consuming balanced meals that are rich in fiber, protein, and healthy fats. These macronutrients help regulate your blood sugar levels, keeping you full longer and preventing those sugar cravings. Opt for meals that include whole grains, lean proteins like chicken or beans, and plenty of non-starchy vegetables. These foods release energy more slowly, helping maintain stable blood sugar levels and curbing excessive hunger. If you notice persistent or unusual hunger, it's a good idea to monitor your eating habits and consult with a healthcare provider. They can help assess your blood sugar levels and provide guidance on how to manage insulin resistance through diet and lifestyle changes. Addressing this symptom early can help you avoid more serious complications and get your hunger and your blood sugar under control. Number 10. Mood swings or irritability. One of the more overlooked symptoms of prediabetes is mood swings or irritability, which can stem from fluctuating blood sugar levels. When your blood sugar is too high or too low, it can directly affect brain function and neurotransmitter activity, which are responsible for regulating your mood. These fluctuations often leave you feeling anxious, irritable, or even fatigued, making it hard to concentrate or stay calm in situations that typically wouldn't affect you. It's as if your emotions are on a roller coaster, with your blood sugar being the driving force behind it. What's especially tricky is that these mood changes can be subtle at first and may not seem related to your diet or health. You might notice becoming easily frustrated, feeling on edge, or having trouble focusing, even if there isn't a clear trigger. This can make everyday tasks or interactions feel more difficult than usual, and over time, it can affect your overall well-being. To manage mood swings and irritability, it's important to keep track of both your emotional state and your eating habits. Eating balanced meals that stabilize blood sugar levels can help prevent these extreme mood shifts. Try to include complex carbs, protein, and healthy fats in your diet, as they are broken down more slowly by the body and provide a steady release of energy throughout the day. Regular meals and snacks, avoiding long gaps between eating, can also help keep your blood sugar levels stable. If you notice that your mood swings seem to correspond with your eating pattern, or if they are becoming frequent or severe, it's a good idea to speak with your doctor. They can help assess your blood sugar levels, identify if prediabetes is a concern, and offer guidance on managing your emotional health. By addressing the root cause, blood sugar imbalances, you can improve not just your mood but your overall health and quality of life. Key takeaways. Let's quickly recap the 10 red flags of prediabetes that you should never ignore. From constant fatigue, increased thirst, and frequent urination, to blurred vision, unexplainable weight changes, and darkened skin patches, these symptoms are often the body's way of signaling an underlying problem with blood sugar regulation. We also covered warning signs like slow wound healing, tingling or numbness, increased hunger, and mood swings, all of which are linked to insulin resistance and fluctuating blood sugar levels. Recognizing these symptoms early is crucial. If you're experiencing any of these signs, it's important to take action now. Prediabetes is a serious condition, but the good news is it's reversible with the right changes. By making adjustments to your diet, exercise routine, and overall lifestyle, you can help regulate your blood sugar and potentially prevent the progression to type 2 diabetes. If any of these symptoms sound familiar, don't wait for them to worsen. Seek medical advice from your doctor to get a proper diagnosis and take steps toward better health. Early intervention is key, and the sooner you act, the better your chances of managing your blood sugar effectively. Remember, managing prediabetes is all about awareness and taking control of your health before complications arise. Start paying attention to these signs, and don't hesitate to reach out for professional guidance to ensure you're on the right track. Prediabetes doesn't have to progress into diabetes. You have the power to reverse it. By recognizing these red flags early and taking proactive steps, you can regain control over your health and prevent long-term complications. Have you experienced any of these symptoms? Share your story in the comments below. Let's support each other on this journey to better health. Don't forget to like, share, and subscribe for more health tips and advice. Stay informed, stay healthy, and take action today.